tell me your story. How did you meet Ed? Tell me about the plane experience.
Okay. I ended up meeting Ed Straker on Facebook and found out we were both from Locust Valley, Long Island, and that he went to school with my brother Ronald. And one thing led to another, and we started to have some conversations on Facebook. He discovered that I was an emergency medicine physician, and he talked to me about, do I know anything about alternatives or healing? I said I knew some. I had participated in some alternative medicine personally on myself, several years ago when I had a severe back injury, incurring 3 herniated disc spinal stenosis, a paralysis of my right lower foot. I couldn't walk without help, without a cane or walker for 3 to 4 months. So I was always already aware of the benefits of alternative medicine. And recently, going through some different things, some personal challenges, Ed was able to help me get rid of some of this overwhelming fear and anxiety and depression. And so that raised my level of curiosity for him. Later on, I found out he had a self-healing mastery course, which I purchased. It was like 7 sessions. They're about 2 hours long.
Here, let's stop for a second.
Okay.
So
I became familiar with alternative medicine, alternative methods, Eastern medicine back in 2003 from personal experience. At that particular time, I had 3 herniated discs and spinal stenosis, which is a narrowing of the spinal canal, which affected, I had weakness in my right lower leg, particularly my right foot was paralyzed. So I was aware of that, and I went through alternative medicine. It took me 3 to 4 months to be able to walk without a cane, a walker, or a wheelchair, but I was successful. I was able to avoid going under the knife and having surgery. And most people, 90% of people have 3 herniated disc and spinal stenosis to get surgery. But I decided, with the help of one of my nursing friends, to try an alternative. It was a little bit more painful process, but over a 3 to 4 month period of time, again, I was able to walk without any assistance. So I came across Ed. He was a friend of my, one of my little brothers, Ronald. We went to high school together. Believe Ed graduated 4 years behind me and stuff. So I knew about him, and we communicated on Facebook. One thing led to another, and we did talk over the phone. And he knew that I had some interest in Eastern medicine and alternative methods for healing. So my interest peaked. So what I decided to do, hit a self-healing mastery course, which consisted of 7 sessions. They're usually 2 hours long. And that particular time, we were all going through some personal challenges, my entire family. And there was periods of being overwhelming fear and anxiety and depression that were unrelenting. What I found is his self-healing mastery course took my stress level, my anxiety level from here down to here, and I was able to function at least and not have it consuming my mind, or I felt this overwhelming fear and that it was consuming my mind 24/7, 24 hours a day, 7 days a week. I felt every cell in my body felt that way. So after taking the self-healing mastery course, I knew this worked.
Great. Can you tell me about, what's the deal with the 30,000? Did you talk to him on a plane? What was that about? Can we talk about that?
There was, he was having another webinar, and he sent me the link for it, but I said, I'm not sure I'm gonna be able to participate, because at the time I was in Baltimore for airway course, and I'd be on a plane at 9 o'clock Eastern Standard Time when this started. And I'm seeing you 30,000, 40,000 feet in the air. How the universe works, I was able to hook into that while I was on the plane. And I was still I've had the back issues, but it was really bothering me the last week or so. The severe excruciating left-sided back pain and left knee pain. And going through the different sessions, we try to send some positive energy and love to those particular portions of our body that may be ailing us or we'll feel sick. And my pain, by the time I landed in Chicago. My pain in my left lower back, my pain in my left knee, it almost completely dissipated. And all that overwhelming fear and anxiety and stress in every cell of my body was totally gone. That was at 30,000 feet. I've had multiple sessions with Ed Straker. In each one, the whole thing is that what people don't understand is when you're inside of your head, that's where all the fear and anxiety, depression occurs. However, when you start to, oh shoot, no way, sorry. No, I shouldn't go there because people think I'm crazy, but that's all right. No, okay. After my different sessions with Ed, the thing that comes to mind most readily is that the level of fear and anxiety is markedly depressed, decreased. In addition, I had a most recent session with actually yesterday. And the thing that I noticed after, I think it was a 15-minute session with him, that after my sessions with Ed, the thing that I could share with people that most commonly I feel less anxiety, less depression, because I share with you that my family had been going through some personal challenges over the past several months. In addition, that some of the ailments like my back and my lower back in general, but my left knee, it always feels much better, and that mostly all my sessions with him, the pain is totally gone after that. My feeling with medicine in general is that we as physicians are there to take care of the patients, not our egos. So if you have different alternatives that work, that help you avoid ingesting pills and someone slicing and dicing you and taking you to surgery, why not? Now, sometimes you may not be able to explain it, but if it works, who gives a rip? The point is you want to feel better. That's the thing. And plus, for me, it gives more power to the patient. Because I have a saying that I want people personally to take back their health and be responsible for their own life because it's theirs. It's not your responsibility. It's not the hospital's responsibility, your doctor's responsibility, the pharmaceutical company's responsibility, or insurance companies. So you have to be proactive and take accountability for your own health. And Ed Straker helps you do that. He gives you tools to use even when you're not with him on your own to help with your illness, disease that's going on in your life, or any type of events that's going on in your life. So I personally, too, would highly recommend him. I look forward to working with him long-term, one-on-one. I've had many sessions with Ed. One of the most common things I feel after my sessions with Ed is that the pain, for example, on my back and my knee is almost always gone completely. And if I had any fear and anxiety about different things that are going on, or any personal challenges for myself or my family, my siblings, it's totally dissipated just with some brief sessions with him. It's not a long period of time. And again, he also gives you the tools so that you could do this on your own. Now, during my session with Ed Straker, he makes you feel comfortable. He makes you feel that you get the immediate feeling or soon thereafter that he can really help you. Because a lot of people say they can help but can't. But you get that feeling that he really cares, he wants to help you, but he wants to help you be able to do these things on your own by yourself in the comfort of your own home. Again, he gives you those tools to make you feel so much better. But at the end of all my sessions with him, like I said, the different pains in my body parts are all gone, and an overwhelming fear, stress, and anxiety is totally dissipated. One thing that's I've been questioned upon is that some people may have some preconceived notion about him. Trust me, Ed's non-judgmental. He's here to help you. I don't think he has a judgmental bone in his body personally. And so that you would come to him with any issue or problem if you're not thinking you get all the right answers from the Western medicine. I'd probably tell you to try him first versus the Western medicine. If the Western medicine is going to entail you ingesting a lot of pills or undergoing surgery, I would try him first. Again, he's probably the most non-judgmental person I've ever met in my life.
So
I'm just saying that at times my thing, like in medicine, I tell people the problem with medicine is most of the things I see in an emergency room are due to poor lifestyle choices. People, but nowadays, because of this PC bullshit, people don't take accountability for their actions. Do you understand what I'm saying? That they don't want to, you can't get in someone's face about, your diabetes, you shouldn't be eating these donuts, right? I mean,
Right.
yeah, he's a direct communicator. He's compassionate, loving, but firm. I would describe Ed Straker's technique or his style as he's compassionate, extremely loving, but he's firm. He's there to help you. He's not necessarily to be there to be your friend. He wants to help you get that result. And let's face it, folks, that's what we all want. We all want the results. We want to feel better. That's the key in all his training and his teaching. He wants to give you the results. So with Ed's help, his guidance, you'll get the results you're looking for. If someone was to ask me what's Ed's unique style, I would say the following. He's compassionate. He's extremely loving and caring. He gives you this big old bear hug, puts his arms around you, but he's firm. He's there to get you the results. He's going to point out if you're making excuses, but he's there to help you get the results. And let's face it, all of us, that's what we want, the results. We want to feel better. We want this illness, disease, or different things going on in our body to go away. We want the stress, fear, and anxiety, depression to go away. Again, he's very caring, very loving, like a big old teddy bear puts his arms around you, but he's firm. I'm just talking out loud, or thinking out loud is that my whole thing is, when I talk to people, because I have a speech I give, it's, and one of the things I do, take back your health and be responsible for your own life because it's yours, that he's helping people take back their power as far as their own health and well-being is concerned. Whereas, Western medicine is changing, but still, it depends on where you are, East Coast versus West Coast versus Midwest, which is very conservative. It's just that it's still that, the more of the powers is in the physicians. Whereas Ed, he's helping you take back your power, take back your health, teach you, give you appropriate tools to make you feel better, to feel healthier, and increase your overall health and well-being. That's how he's different than most people. Ed's different because Ed helps you take back your power. He helps you get involved in your own health and well-being, and that's the key that makes him different. Whereas with Western medicine, still, it seems like more of the powers is in the hands of the physician versus the patient, and the patient's not really involved as much as I would like in his own health care. Whereas Ed is totally different. You're working together as a team, and it eventually gives you the tools that you do a lot of these things on your own. That makes them different. That makes them unique. Yeah, you see, this is my feeling, because some things, I was just talking to my wife about stuff. She has to always understand stuff. Robin, do you know how fucking electricity works? No, you still fucking use it. I mean, do you understand? I mean, people just have to understand everything. To a skeptic, I would say the following. I'm not sure personally how all this works. I know it just works. At least for me, I was at a ugly place, an icky place as far as my mind, my stress, my anxiety and depression, because all our family personal challenge we were going through recently. It works. I would just tell people to try that. If they tried other alternatives, if they tried other things in the past, and it's not been helpful. If you want the results, if you want to feel better, if you want to get out of that fog, what do you got to lose? What do you got to lose? And again, you want that result. And Ed, with your help, though, you have to be a participant, because it's about your body, too. He'll help you get the results. And that's what we want. That's what I want as a Western medically trained physician. I want my patients to feel better. I want them to get the results they're looking for. And we could do this as a partnership. That's my goal, but we're not really allowed to do that in Western medicine, where Ed gives you that opportunity to be more and more involved in your own health care versus Western medicine. We're getting better, but we have ways to go. To a skeptic, I would say the following, that I just know it works. Like some people want to know everything, that how certain things work. But my question is to you, do you really know how electricity works in your house? Do you know why your car turns on? No, and you don't really care. It just works. Similarly with Ed, it just works. To a skeptic, I'd say the following. Do you know how your electricity works? You probably don't, but it just works. Ed, he just works. That's what I would tell you. I don't know how old you are, but you remember Star Wars and they talk about the Force?
Yeah, sure.
Okay, there's energy all around us.
Oh, I get
Energy can be either created or destroyed. And the thing is, what people don't understand, like, there's a portion in the Bible, Jesus walks on water with Peter. And then Peter's lack of faith made him sink and he got in the boat. Jesus says the following, you could do the same thing I could do, but greater still. Now, most people think that Jesus was bullshit. Meaning that he was just saying that figuratively. No, literally. We don't tap into our energy. You heard the thing about people say that we only use 10 to 20% of our brain capacity, which is true. So if you get quiet and you could connect to like how they did in Star Wars, there's ways when you sit quiet and you connect. It's deep meditation. You feel different. How did my knee and my knee pain and back pain go away at 30,000 feet? I know it was killing me. It's been killing me. Okay, so that's what energy is, tapping around the different forces around you, where some people are connecting to Mother Earth, connecting to the universe, energy of God, or whatever you call it. That's what he's talking about. Because I've been on some things, retreats before. I've seen some shit that people you just wouldn't believe. I don't tell people because people think you're nuts. Mm-hmm. Okay, so before I met him, before I met Ed, my view of energy healing or my knowledge of energy healing was very, very low. However, after going through a self-healing mastery course, I was excited about the possibilities about learning more about this energy healing, and the possibilities to me were endless. Before I met Ed, my view of energy healing was extremely low. However, after going through a self-healing mastery course and some of the other sessions and webinars with him, the possibilities for energy healing to me were endless. What it means to me, I'm not very knowledgeable. But energy healing to me is you're able to tap into the universe, you're able to tap into Mother Earth, but you have to become very, very quiet and get out of your mind and be still. And eventually, if you get quiet enough and you connect enough to the universe, energy, God, or whatever you want to call it, and Mother Earth, that's what it means to me. And you're able to tap into that type of power somehow, some way. But it takes training. I'm just learning about it myself. But that's my understanding of it.
Cool. The whole time.
No, it's just my father had passed away. It was tough. It was a tough thing for the family, and I was in a very dark place. And at that particular time, I didn't really care if it worked. I knew that I couldn't go on feeling this way and function normally. So I was opened. But I had contacted him before that, and I think too. Yeah, I had gotten a self-healing mastery course prior to that, but this forced me. Didn't force me. I was trying to find out any way possible, legal, moral, and ethical, of course. What could I do to get rid of this fear, anxiety, and depression because of my pop? And it worked. It took me like 10 days to go through it, because it's 7 sessions, 2 hours, and taking notes, and then taking my notes and then typing them in. I was at a loss. I felt like I was drowning. I was going down for the last time. It was hard. Oh, I'm sorry. I don't know. Oh, God. But what you said to professionals. There's some references and research materials that you could check out on your own. I don't blame you for checking it out on your own, but it does work. But there's some information to back it up too. And he has helped hundreds, if not thousands of people are getting results when they couldn't get results any other place. So I would encourage them, you know, to research the information. You could research even about Ed to get some of your answers, get some of your questions answered. That's what I would suggest that you do. Ed has helped me out on a couple of things, but most recently, actually was my left knee and my left lower back. Now, mind you, Ed is located in the Philippines, and I live in the United States, in Indiana. And through Skype and through his energy healing, I was able to have my knee pain go away all the way, my left-sided back pain go away all the way. That was just through Skype. And actually, it was just yesterday on, I think it was Wednesday, whatever day it was, the 12th of September. I don't even know what day it is. Yeah, it was the 12th. But that was through Skype. That was the most recent session I had with Ed. So it worked. Like my knee still works good today. My back's not bothering me. And yesterday I worked out for 2 hours, like hour and a half of lifting and 30 minutes of cardio. Today, up at 4:30, hour and a half of lifting, 30 minutes of cardio. No pain in my knee, no pain in my back. What I would share with the orthopedic physician is that if they have any clients or any patients that have chronic joint pain, that I know that Ed would be able to help them as far as their chronic joint pain, be it their knee, their shoulder, or their hip. What's that going to do for you? It's going to lessen that probably the scripts you have to write for them, you know, the type of pain medication for them. It may lessen their visits to you. They may be more open-minded to not just getting less pain medications, but physical therapy and all of our alternatives. So it's a win-win situation for the patient, which is the most important thing, and you as an orthopedic doctor too as well. Look, David, you've been telling about your knee been killing you the last 6 months. You've been to your doctor, and all he does, he's giving you anti-inflammatories, maybe a narcotic or two, and you're still not really any better. You're limping around. You had to take a little bit of time off from work because of this. You tried all these other things. If I was you, if you were my friend, and you are my friend, this is what I would do. I would tell you to go to Ed. He'll probably help you get off the pain medications, the anti-inflammatories. You won't be limping around. You won't be doing those doctor visits. You won't be missing any work. And that's what we all want. Like, it means because of my course, the Self-Healing Mastery course, that I have the 5-minute meditation healing session that I could do by myself, or a 15-minute healing session. So I would say, as a result of my healing experience with Ed, that I now have the tools to help get rid of this lot of pain in my knee and my back, help rid these periods where I'm feeling a lot overstressed, anxiety, overwhelmed. I've had the tools now to do this on my own. So that's one thing that I love, because I could do this without him. I don't necessarily need him to talk to or communicate him to get rid of some of these different illnesses that I may be suffering with occasionally, which we all do. Through working with Ed with the Self-Healing Mastery course, I've been able, I have the tools now to help myself. I have the tools to, when I have excessive knee pain or back pain, to help lessen it on my own by doing some of the Self-Healing Mastery courses, certain meditations. I don't necessarily need him to be present. So he's giving me back my power, which I like. Through working with Ed, I feel that I have the tools now to help myself do the self-healing. I have the appropriate tools to help myself. my back is acting up, when my knee is acting up, when I feel overwhelming stress and anxiety. Because of the working with him, I have the tools to help myself and to better myself. So thank you, Ed. I just remember, it's just that every cell in my body felt stressed, anxious, depressed. It was overwhelmed. I haven't had a feeling like that. Anyways, he was going to have a webinar. I shared with him I didn't think I'd be able to participate because I was flying back in from Baltimore after attending an airway course back to Chicago. So when this started, I'd be 30,000 feet in the air. How the universe has it, I was able to connect even at 30,000 feet in the air to participate in the webinar. Like, he didn't know this at the time about the feelings I was going through, feeling overwhelmed, stressed out, and anxiety, and my knee and my back were killing me. But through that particular webinar, which lasted about an hour and a half or so, by the time that session ended, I had no knee pain, no back pain. My fear, anxiety, depression was almost completely dissipated at 30,000 feet. Now, I didn't really care how it worked, but I could tell you that I've been feeling bad for like a week and a half with that intensity, that just overwhelming. But after that session, gone. What I would say to people that suffer from depression, anxiety, or other type of illnesses, that if you haven't gotten any answers from all the things you tried in the past, I would highly recommend you go see Ed, because he's helped me out tremendously. And that now, if I feel some of these things coming on, I know exactly what to do. I don't necessarily have to sit down for a 5-minute meditation session for myself or a 15-minute. I could do something in 30 seconds and make everything kind of go away. Again, he gives you the tools that be able to help you help yourself, which we all want. And my prayer to helping out patients is that take back their health and be responsible for your own life. Be more accountable. Be more involved in your health. And what Ed does, he allows you to do that by giving you the tools to help yourself. And it's not that hard, but it's not easy too. You have to be consistent and persistent in doing these little exercises. That's what he does. Helps you take back your own power. You never lost it, but you're not taking advantage of it. You're just like letting other people steal it away. But he's helping you get back your power to help heal yourself. That's why he's different. Okay. I don't know if that helps or not.
Yeah, that does. So
since working with Ed, I have other tools to use to heal myself, take back my own power to heal myself. I don't have to necessarily depend on anyone else for that. He helps you tap into that power you already have and use it to help heal yourself and get the results that you want. Since working with Ed, he's given me other tools that I could use to help heal myself, to help get better overall health and well-being. That's why I love working with him. And I feel if you work with Ed, you'll be able to say the same thing too.